Hello everyone, Rick Wilkinson again. We'd like to talk today about entering a patient into the Alabama trauma system as far as tracking it for a stroke patient or suspected stroke patient. So first we would like to start off by saying that in the past we used to have this 3-hour cutoff that anybody that had stroke systems that were new onset over 3 hours, it kind of changed the way we entered or treated this patient. But now with some new technological changes, we want to make sure that we're entering all stroke patients into the system and then allowing the system to kind of guide us where to go as far as a level 3, a level 2, or a level 1 stroke center. So we want to use the Cincinnati Pre-Hospital Stroke Scale, or many of us use it or call the FAST assessment. Now again, we're looking at facial. We're looking for, normal would be both sides are symmetrical. If you had an asymmetrical or they were unable to lift one side, that would be a positive. Their arm drift, we want to hold them out, palms up for 10 seconds. And obviously a positive would be one side would drop, the other side wouldn't. Speech, you can't teach an old dog new tricks. Normal, obviously there's no slurring. Any abnormal would be a slurred speech or inability to say the words. We want to still track our time though. When do these neurological symptoms start? Now, many times, if a patient lives alone or hasn't been seen in the last 12 hours, we may not know an exact time, so that may still be unknown. But if you know, please mark it. If it's 3 hours, 2 hours, 4 hours, 6 hours. Level of consciousness. Are they alert? Do they respond to voice? Do they respond to pain? Or are they truly unresponsive? Make sure, because hypoglycemia is a mimic of strokes. We want to make sure that we're ruling out. My suggestion, just my suggestion, is to check the blood sugar before you activate a stroke alert or calling the TCC to enter a stroke patient in the system. Now, the question we want to ask, do they have a history of stroke or brain tumor or aneurysm? Any other AV malformations in their brain? Is the patient pregnant? Is there past history of bleeding disorders? Are they on Coumadin, Lovenox, anything like that? Surgery in the last 2 weeks anywhere on their body? Any intracranial or intraspinal surgery in the last 2 months? Or gastrointestinal or genitourinary bleeding within the last 7 days? Not all of these will push somebody out of the option of neurological or chemical treatment, but some of them may. So we want to make sure that we understand this. Now also, the state of Alabama says that you are supposed to leave a copy of the stroke form with the facility. So make sure that if you need copies, give it your supervisor, make sure you have those. But that's what we really want to do, is we want to make sure we enter the patient in using the FAST system or the Cincinnati Pre-Hospital Stroke Scale. We want that time at the end is very crucial. And we also want to make sure that we're telling the hospital what the glucometer reading is. In northern Alabama, we have plenty of level 3 stroke centers, Decatur, Morgan, Parkway, Moulton. They are level 3s. Madison's a level 3. Crestwood is a level 3. Huntsville Hospital is a level 2. And Chattanooga would be our closest level 1 at Erlanger Hospital. I hope this helps. Thank you so much.